All right, everybody. I have on Dr. Maggie Hill on the podcast, and I'm really excited to chat with her. Um, I've been following her on Instagram for a long time, and I feel like, did we meet through I had a friend that was on a flight to Whitefish, and
I
she,
something like that, I think, and then connected through Instagram and
yes, yes, okay,
got
yeah.
married
So
out here. And
right. So I got married in Whitefish, and then my friend and her husband loved it. So they go there all the time now. And then I think she met you on a plane ride and then shared with me your account or something like that, like several years ago. Um, so yeah, I've been following you for a long time, and followed you through your last pregnancy and your birth and the work that you do with pregnant women. So I'm really excited to have you on. We haven't had a birth story in a while, like a long time. So I'm really excited to chat with you, to share yours with us. So thank you so much for coming on the podcast.
yeah, thanks for having me on. And I appreciate you giving me the opportunity to share my birth story because it's kind of crazy and I haven't fully shared it on any platform. So it's nice to be able to have the opportunity to just talk about it.
Yeah. Well, before we get into the birth story, um, I'd love for you to maybe just tell us how you planned for that birth and what were you envisioning? And then just kind of going into what happened.
Yeah, so I am a prenatal chiropractor, and so I'm very holistic minded. And my ideal birth was always to have a home birth. And kind of from the get-go, I had a really rough pregnancy. I was one of the lucky few to have hyperemesis. And so my first trimester was a real struggle. I was really sick and I had to get weekly IVs for fluids and just could not keep anything down. And so I just had in my mind, okay, pregnancy is not going at all as I planned. And I just had this vision of birth that I was really hoping would kind of redeem the experience because I didn't get really a joyful pregnancy like a lot of people get to experience having hyperemesis. And so I planned for a home birth. I have a really good relationship with some local midwives, and my husband is also a chiropractor. So he was really on board for a home birth. I hired a doula who is one of my good friends. And so I felt really confident with my birth team and the support. I was getting adjusted with Webster chiropractic from my husband all throughout my pregnancy. And I did pelvic floor physical therapy to try to prepare. And I just felt like from a holistic standpoint and in the crunchy community, I was doing all of the things to try to guarantee my success for a home birth. And I did the hypnobirthing course. And part of that, you have a section that's about your fears and anything that you're concerned about for birth. And so I wrote down that my fears would be, if I had to transfer, if I ended up having to have a C-section, and really tried to work through those fears. And part of that was because I was a C-section baby. I was a stubborn breech baby. And now my mom's like, oh my gosh, breech is just a variation of normal. And she knows that now. But at the time, that wasn't really an option. And so I had that in my head of what if I have to have a C-section? Um, and so part of that with writing my birth plan is I wrote, my ideal, unicorns and rainbows birth plan for if everything goes right. And then I also wrote, if shit hits the fan,
Yeah.
what are we going to do? Because I had been to a home birth transfer that ended up in an emergent transfer before, and I had seen that. And so I knew that, even though the chance was so, so low, that there is that possibility. And so what can we do to prepare to still have a say in things if it were to go that route? And so I kind of had my plan A, B, and C in my birth plan written out. And plan A was, have this home birth at home with my husband, surrounded by our birth team, ideally have a water birth. Plan B was, if we need more pain measures and we need to go to the hospital, what is that going to look like? Are we going to get an epidural, try nitrous? What would that look like? And then plan C is okay, if it ends up in an emergency C-section, what are the things that I would still want to have if I could make that call? And for me, that was being able to have a clear drape, being able to do skin to skin if it was a possibility right after, still do delayed cord clamping, So I kind of had all of those things in my head ready to go if needed. And so I had in my head also that, I'm a first time mom and a due date is just an estimation. And so I tried to mentally prepare myself that I'm probably going to go 41 weeks or more. That's totally normal for a first time mom. And that time came and it was really hard. And I hit 41 weeks. I'm like, okay, any day, any day. And finally, when I was 41 weeks and 5 days, I lost my mucus plug. I was like, okay, this is a good sign. Labor will be close, hopefully. And I started having contractions and just got some groceries and started doing things around the house to prepare. And then that evening, my husband and I were playing cards, just trying to take my mind off the contractions. And they weren't super regular at that point, but I was like, I think something's starting to happen. And like most first time moms, I'm excited. I'm wired. I don't want to sleep because I know labor's coming, but I'm telling myself, okay, you've seen this before. You need to sleep. Try to sleep during early labor. And so we went to bed and I got, maybe 2 hours of sleep before I woke up from my contractions really ramping up more. And I texted my midwife to just let her know, I think this is in fact labor. My contractions are getting a little bit more normal. I'm going to try to fall asleep again, but I don't know if I can. And I texted my doula to just kind of keep her in the loop. I was like, I'm good right now. And ended up going out in our living room and just kind of working through the contractions. I wanted my husband to be able to sleep and everything felt really manageable. I felt good. And by about 8 a.m., I still hadn't really fallen asleep. I'm working through my contractions and they were about 4 minutes apart, lasting about a minute, like pretty consistent. And I could still move through them and talk through them. And they hadn't really picked up in intensity. So I tried some forward leaning inversions and tried to just get a little bit more pressure on my cervix. And by like 11 o'clock, I started throwing up. I was having diarrhea and I'm like, okay, this is a good sign. Like things must be progressing. I know that that's usually a good sign. I'm going to try to rest again. And it was just too intense. And so at around 3 o'clock, I had my midwife come by because I was like, I just want to like have you check in, make sure everything's good with baby. I'm still feeling okay, but things haven't picked up a ton. And I feel like at this point, I'm at like 12 hours now of pretty consistent contractions. And I don't really feel like they're picking up in a much of intensity. And so I did opt for her to do a cervix check, which in hindsight, I'm like, I knew I didn't want to do that, but I did it anyways because I was anxious and wanted to know. And at about 3 o'clock, I was only 1 centimeter. And so I immediately just felt defeated because I had been working through my contractions all day. And I felt like they had been like productive contractions. I felt like she was sitting pretty low in my pelvis. And so I was just kind of feeling defeated because I'm like, only a 1, come on, even though I know things can change so quickly. And so my midwife was like, you know what, like stop timing your contractions. I think you're getting in your head about the timing. So stop timing them. Why don't you take a bath, relax, maybe try having a glass of wine, see if that would help you relax a little bit more and get some rest, and listen to your hypnobirthing tracks and see how that helps. So I finally took a bath and had a little glass of wine and listened to my hypnobirthing. And I was actually able to take about like a 40-minute nap. And I felt really relaxed afterwards. But I was feeling a little bit anxious because now we're heading into nighttime. It's like 6:30 at this point, and I'm starting to think about the fact that I didn't really sleep at all last night. And now we're heading into another night. And what if I have another night without sleep? How is that going to go? Am I going to be able to have the strength to push this baby out? And so I just kept laboring, and my husband was there and he was doing all the things possible to try to help make me comfortable. And by like 1 a.m. that next night, I was so uncomfortable. I couldn't really rest much. And I didn't know what I needed from him, and he didn't know what to do. And I was like, we need to call the doula. She's going to know. So she came over and she got there at about like 1:30 in the morning, and I had been laboring in the shower, and she just immediately started doing counter pressure, which was a godsend, and knew exactly what I needed, and helped my husband get into different positions with me, and just they were just speaking affirmations over me, and it was just everything that I had wanted in that moment just seemed like it was finally kind of coming to fruition. And I just felt things start to pick up in intensity, and by like 3 a.m. I'm feeling more primal. I'm starting to moan and yell and groan, and really thought at this point, wow, like this is coming soon. Like this baby's got to be joining us really soon. And so they called the doula, or called the midwife. My doula was like, hey, you should probably call her. Looked at my husband and was like, I think things are really picking up, like the way she's moving and the sound she's making. It sounds like we're really progressing here. And so my midwife and her assistant came by, and I got into the birth tub at about 4:30 in the morning, and I literally experienced, I think, every possible emotion when I was in the birth tub. I was laughing, I was crying, I was listening to my hypnobirthing tracks, and then I hit the point where I was like, I can't do this. And I just started sobbing. And then afterwards, my doula was like, you're close, you're close. Like that's usually a good sign when you're trying to
Mm-hmm.
tap out. Like that means you're close. And so they recommended that, after I had spent some time in the tub, they said I should try to get out of the tub and try moving around the house. They did another check, and I was only at a 4 this time. And that just totally just hurt. It just hurt to hear that, because I had been at births before. I had seen the progression, and I felt like I was doing so much work at this point. So to hear that I was only at a 4,
Mm-hmm.
I couldn't believe it, because of how intense things had gotten. And it was at that point that my midwife said, it feels like baby's asynclitic. It feels like her head is tilted in your pelvis kind of the wrong way. And it just feels like it just feels off at this point. So we need to try some different positions to get her head to shift back into your pelvis the right way. And so we tried a lot of different positions. They had me sit, backwards on the toilet and crawl into bed and do kind of like a side lying release. And I had a peanut ball, and all of these super uncomfortable positions that I kept telling myself, this is good. It's usually a good sign if it's painful in these positions, it means it's doing something. And after a few hours, we checked baby's head again, and no change. And I couldn't eat anything. I felt so sick, and I just got back into the tub, and I just cried, because at this point I knew what was coming. They were trying all these things. I'm dehydrated, I'm exhausted, and I have nothing left in the tank. And so I know that the recommendation is going to be that I need more pain management. Um, and and so I cried, and I looked at him and I said, I feel like our best option is probably a transfer at this point. And they said, yep, we agree. You should probably try to go get an epidural and see if that will allow your body to just rest enough that you can actually sleep and maybe be able to eat something. And it might help take the edge off enough that we can get baby to switch positions. And so luckily, it was a non-emergent transfer, which I think is a really big misconception with home birth transfers. People hear you transfer and they think that you were rushed out in an ambulance. And a lot of the times when there are transfers, they are non-emergent transfers. And the most common reason is for pain management. So we transferred, and I was really relieved to see that the hospital midwife that was on call was a midwife that I had seen earlier in my pregnancy with the HG that helped me with getting IVs. So I already knew her. So I felt like that was kind of like a little God wink, that God was like, yep, you're making the right call. Like, I'm going to make this a good experience for you still and allow you to be comfortable. And so I transferred, and I got the epidural. Um, and they checked and confirmed I was still 4 centimeters. And at that point, when they checked me, my water broke. And so they wanted to start Pitocin. And so they started me on a slow dose of Pitocin to see if they could help me progress. And at this point, I'm like, okay, I'm doing things that I did not think I would be doing. This is kind of the plan B. Shift your mindset. Like, you can still have a great birth. And I was just really slowly dilating, but I was so uncomfortable. So I couldn't feel my contractions with my epidural, but something felt really wrong that I still wasn't able to rest. And for about an hour, I'm telling the nurses something, like I can feel something. It's really, really uncomfortable. And I feel like it's the catheter that's in, the urinary catheter that I have in. I don't think it's the actual epidural. And after an hour of advocating that they just please check it, they finally checked it and they're like, oh yeah, your catheter is in wrong. We should probably fix it.
Jeez.
And I was like, yep, I'm not crazy. I know I'm sleep deprived and I'm in labor, but I know my body. And so they finally fixed the catheter and I was able to rest. And a few hours later, I was finally dilated to a 7 and had a cervical lip. So we were trying repositioning to reduce the swelling, and all of a sudden my blood pressure just started spiking. And I had really normal blood pressure throughout pregnancy. Even at the end, my blood pressure was really, really normal. And so when I heard the machine start going off, I'm like not even registering that this is me. Because I'm like, there's no way. I feel totally fine. I have no signs of high blood pressure. And then I realized, I'm like, that's me. That's my blood pressure. And it spiked to 180 over 100. And the midwife looked at me and she said, we need to go consult the OB who's on call now. And so she goes and talks to the OB, and prior to even coming into the room, prior to even meeting me, hearing anything that I had wished for birth, just knowing that I was a home birth transfer, her response to the midwife with my blood pressure spiking was, tell her that we should just take the baby through the sunroof.
Oh my gosh. Like you're a car.
Like I'm a car. Like, let's just cut her open and take the baby through the sunroof.
Jeez.
Not even a discussion, just right into that. And I looked at the midwife and she looked at me and she's like, I know that's not an appropriate thing to say. I just wanted you to know that that is what she told me. And I was like, let's have her come in here and actually meet me and check me. And my home birth midwife and the hospital midwife had agreed that I was 7 centimeters and at about like a +1 fetal station. And the OB comes in and she barely really acknowledges us, does a really abrasive cervical exam, and looks at me and kind of scoffs and says, you're maybe 5 centimeters. And there's no way your baby's a +1 station. You're maybe a 0.
Jeez.
And I said, okay. And she said, you're being diagnosed with preeclampsia. Your blood pressure is really dangerous. And we can do this one of 2 ways. You can either go for a C-section now and be awake and be able to make some decisions about how you want to do this. Or if you want to wait, that's fine, but it might be an emergency and I don't know what will happen to you or your baby. I'm like, oh, okay, so we're going to play the dead baby card. That's fun.
Right.
I don't want to risk having to have general anesthesia. I would like to just be awake. And so after a lot of prayer, having our family come down, praying with them, we decided to go for the C-section. I knew I wanted to be able to be awake for it. I knew that I wanted to have a clear drape and be able to watch the procedure, and wanted to be able to still call some shots like delayed cord clamping and skin to skin, give her the opportunity to have a breast crawl, and to be able to have my husband be in there and take pictures and videos of the process. And I felt just this wave of peace come over me that I can only explain as like God literally telling me, Maggie, you're not pushing this baby out and you need to have a C-section. And I felt peace in that moment because in my mind, I'm thinking, okay, this is how this is meant to be. I've tried, this is how it's ending up, but this doesn't mean that going forward, it'll be like this. I had in my head, I'm like, gosh, people have VBACs all the time. And so that wasn't even a concern to me, really. I was like, this is just what we're doing. And so they prepped me to take me back for surgery. And then I spike a fever. So then everyone's worried that I'm going to have an infection and more worried about baby. And they assure me that, we're taking you, your husband's going to get scrubbed in, and we will not start surgery until he's in the room with you. And so I'm there, and my biggest concern, they asked me, like, what's your biggest fear with this C-section? And I said, either not coming home with a baby or being able to feel it. Because my mother-in-law had a C-section where she could feel it and they didn't believe her. And that was super traumatic. And she still gets choked up talking about it. No, understandably so. And so I looked at the anesthesiologist and I said, I don't want to feel this. Like, please, please, before they cut into me, please make sure that I will not feel anything. And he was a total godsend. He was probably the best person to have in the room during that surgery. So made sure I couldn't feel anything. And then they start the surgery and my husband is not in there. And I'm looking around. My arms are strapped to the table, so I can't do anything. And I'm like, where's Cody? Where's Cody? And he comes in and he kind of gives me this look of, what the heck? Like, I wasn't expecting to walk into a room where you're already cut open when they assured me that that's not how it would go. And he came to my side and immediately was comforting me. And they had told us prior to going in that surgery would probably take about 5 to 10 minutes to get her out, from start to finish. And so I'm watching through the drape and my husband's videoing, and I don't have a great concept of time because I've been in labor for 2 days and I haven't slept and I'm drugged up. But I'm like, wow, this feels like it's taking so much more than just 5 to 10 minutes. And I'm looking at the midwife and the OB, and they're both just yanking on my body, just like they look like they are doing just a CrossFit workout, like so, like just pulling and tugging. I'm like, wow, this doesn't seem normal. And then the OB calls for the nurse and asks him to use his fingers to try to push baby's head up out of my pelvis because she was so far engaged in my pelvis, like the midwife had thought that she disagreed with, that they couldn't pull her out. And so he had to go below the drape and shove his hand 4 fingers up to try to push on her head. And he's pushing and he's pushing and he goes, I'm doing everything I can. I can't get her head. I can't dislodge it from the pelvis. And so in that point, the OB decided to make a vertical incision, an additional incision off of the horizontal incision. And it's known as an inverted T incision, and to be able to pull her out. So she ended up delivering her by her feet with breech maneuvers, which I have now been told by a few different OBs that is not common at all. She told me in her 30 years of practice that I am the only person she has ever had to do that on. And immediately they rush her over and she's not breathing well. And so now I'm laying on the table. I've got shakes. I pretty much had labor shakes all throughout. I'm strapped to a table. I'm cut open. I'm not hearing my baby cry, and I'm not seeing my baby. I just see a mass of people over in this corner working on my baby. And I just start panicking, thinking everything has gone sideways. This is the exact opposite of everything I ever wanted. And I'm not even going to be leaving this hospital with a baby now. and how am I going to recover from this? And what is my husband going to think of me? I feel like I failed him. And they told us afterwards that it was about a minute and a half that they were working on it. Thank goodness my husband took videos of the process that we could look back on so that I would be able to process it. And it ended up being almost 4.5 minutes that they worked on our daughter to make sure that she could breathe, before I got to see her and even know that she was okay. Before anyone came over to tell me that she was okay, I'm laying on a table cut open and no one's telling me what's happening to my child. And finally, the anesthesiologist comes over and he's like, I just want to let you know she was having trouble breathing. They're working on getting her breathing again. She's going to be okay. And I was finally able to, breathe at that point, knowing like, okay, she's alive. She's going to make it. And they finally brought her over and put her on my chest. And the first thing I asked was, can I move my arms? Can I hold her? And they said no. I'm like, oh my gosh, this is torture. Like my baby that I just thought wasn't going to make it I can't even feel her. Like she's on my chest, but I can't even hold her. And so they finally got us back to the room. I put her kind of on my stomach and my chest and gave her an opportunity to do the breast crawl. And she latched right away, which was amazing. I was so worried with having a C-section that she wouldn't take to breastfeeding easily. And that was kind of one of my big concerns, but she did awesome. And my doula and home birth midwife were still there. And so they got to love on us and meet her. And my husband's parents had come. And so they got to meet her. And so that was really special. And then the OB came in to debrief with us. It's, probably not even an hour after surgery. And she tells me first thing that, I had to make an additional incision. You have a T incision now. And because of this, you will never be able to have a vaginal birth. You will have to have C-sections. And I only think that you should really have 3 children. I'm like, wow. I look at my husband, I'm like, I'm an hour postpartum and you're telling me how many children I can have and what all of my future births are going to look like? Like, okay. And she's like, but it's okay because I had C-sections with all of my kids. And so you'll be fine. And I was like, okay. And oh, by the way, you have CPD. And I was like, now we're diagnosing me. Okay, so first off, I have to have a C-section. Next, I have a C-section with a rare incision, and I can't have a vaginal birth. And now you're telling me that even if I wanted to have a vaginal birth, that my pelvis is too small to birth a baby, which I know is not a supported by evidence claim. And so now I'm just irritated.
Mm-hmm.
And not only do I have to grieve the birth that I wanted to have with this child, I'm now grieving the birth of all of my future children, feeling like in one moment that all got stripped away from me. And so the recovery process, obviously physical healing from a C-section was no joke, but the emotional process of not only grieving the home birth that I didn't get, but then thinking I'm never going to be able to have a home birth, I'm never going to be able to have a vaginal birth, that just destroyed me and made me feel so less than, and like I was less of a woman because I couldn't do that. And my husband is wonderful and assured me that he didn't think anything less of me for that. But there was just that, when you're in the crunchy community and you know all the statistics and the desire for a home birth, to feel like that you failed that and then have this like shame and guilt because you couldn't accomplish that, like you're a failure for not doing it, that hit me so hard. And being a chiropractor who specializes in prenatal care, who literally works to help women have the birth of their dreams and be able to have a seamless vaginal birth, I just, I didn't know how to handle it. And I didn't know how to grieve that. I didn't know how to process that. And so pretty much anytime my baby was asleep and I was by myself, I was just crying and just trying to process that. And it took probably a month for me to get to a better headspace where I was like, okay, I found this group of women who have these special scars like me. And many have gone on to have vaginal births. And so it just gave me this little spark of hope that maybe someday, maybe I'll be able to do that, even though she told me the exact opposite. Maybe that's not how this has to go. And maybe now God's plan in all of this was to just give me this perspective so that I can have even more empathy being in the country community for when things don't go as planned for people, to be able to hold space more efficiently, be more empathetic, to be that person that can be there for someone whose birth doesn't go as planned and actually know how that feels now. And so that's definitely, I would say, like the silver lining and something I'm grateful for that I've been able to process now a year later and have that perspective now.
Mm-hmm. Yeah. Well, like you said, you haven't shared much about this. So I didn't know like any of this happened. Um, man, when you were describing the OB, somebody's like bedside manner can like make or break your experience. So even
Totally.
like the tone of like, no, you're just 5 centimeters. Like, it could be like, oh, I think you might be a little less, but like, or even
Mm-hmm.
if you're already planning a C-section. So why the need to like demean,
Yeah.
kind of like that. And then obviously delivering that news like after your birth. Uh,
Mm-hmm.
not the time and place
No.
to go through that. And it's, yeah, it sucks because I know that like obviously you did so much work into planning your birthing team. And then when you do transfer, being a home birth, a lot of times you are treated as if like, oh, this poor child, like
Exactly.
who thought they
And
could do it at home?
yeah, and I feel, I really truly feel that that was part of the bedside manner was, oh, you're that girl. You're the one who thought having a baby at home was safe. And I kept telling when the nurses would come, because they were all great and they would um, talk about, that I was a transfer. I kept telling people like I chose to transfer. That was my decision. I was not an emergency transfer. I didn't come in here with, my guts falling out of my body, anything
Right.
crazy. You
Mm-hmm.
know, if if you didn't know that on my chart that I was planning a home birth, you wouldn't have known any different from anyone else coming in that's just normally in labor
Right.
at that point.
Mm-hmm. Yeah. Um, and I mean, you touched on how like most transfers are non-emergent, most are for like pain relief, and that is a huge misconception um, with home birth. They're like, oh, well, the percentage is higher for first-time moms for
Mhm.
transfers, and it's usually because labors are longer and they want some rest or they want some pain relief. And um, it doesn't mean that home birth isn't safe. It means that
Right.
you have options.
Yep.
So, yeah, and I think that it was so important that you worked on like your birth plan beforehand and included that C-section thing on there because obviously that wasn't something you were planning for, but you knew that you had options in that moment.
Yes. That's something I'm really grateful for because when I've talked to people who have had C-sections, they didn't know that they had the options for those things because they're not often presented with the options. And I know not every hospital has clear drapes, but I would say a large majority at this point, especially if it's, a baby friendly hospital, as they say, I feel like majority have clear drapes. And so just having that option, which I know some people don't want to see that. For me, I wanted to be able to be as involved in the process as I could. And
Mhm.
so just knowing like in that moment being like, okay, we're doing this. Here's what I want to make this a better experience. That I feel like helped a lot.
Mhm. Yeah. Um, well, and I think people think clear drapes that you're going to see the whole surgery, which you don't.
Right.
You'll see when they're pulling the baby out.
Yeah.
You're not going to see
Yeah,
any of
like I couldn't
the,
see my insides. I could just see where they were working. And then,
right.
yeah, I saw when they pulled her out.
Right. Um, I want to talk about like how you were like, I didn't want a cervical check, but I got one anyways. And I'm somebody, I always talk about cervical exams. Um, but I always say that you can like use them to make decisions. Like,
Mhm.
I don't think routine cervical checks in pregnancy, they're very invasive and unnecessary. In your birth, it's unnecessary, like, unless you need to make a decision. So, like, after being in labor for 30 some hours, and then like hearing you're at 4 centimeters, that's like, okay, like, I need to make a decision because I'm exhausted. But if they had checked you and you were 9 centimeters, like, you would have made a different decision.
Totally.
So I think that, because I harp on cervical exams a lot, but I think that it's good for decision making, when you need that information to be like, okay, like, what's next? Can I do this? You know?
Right. And even with, they checked me and saw that she was asynclitic, and then we did
Mhm.
everything for like a few hours. And that next check, I was pretty much like, I don't want to know, but I know that like you guys obviously need to find out like, did baby's head move? Are we okay? And it was one of those things where like they didn't even have to say it at that point. I just saw, like, you could just tell, like, she's in the same position. We haven't progressed. And so I pretty much like cut them off before they even had a chance to really tell me. I'm like, she didn't move. I'm still at a 4, aren't I? And it was kind of like, yep, you are. I don't want to tell you that, but yes. And I feel like if I hadn't, if we didn't know she was asynclitic and I kept having those. I mean, my midwife even told me, she's like, Maggie, I thought like there was more than one moment where watching your body language, I thought you were about to be in transition
Mhm.
because your body had all of the signs. So if we hadn't have done the check to even find out, I don't even know how much longer, like, and how much more depleted I would have been at that point. Um, and we likely would have obviously, probably made the same call anyways to transfer if I labored for that much longer, and still wasn't having a baby. So
Mhm.
I definitely think there's a time and place. I always tell people, they're going to want to check you when you're like 37 weeks. That's totally unnecessary because you could sit at 4 centimeters for a week and not even know it. Um, but yeah, I do think time and place for when they can be beneficial for sure.
Mhm. Yeah. Um, my midwife told me something that like has stuck with me since my first birth, because the first like 20 hours of our labors were very, very similar. With not being very dilated, throwing up, my team thinking I'm in transition, and I was 5 centimeters for a very long time. Um, and she was like, birth isn't linear, like, it doesn't look the same. And you can go through transition and it might not be a number that's on your cervix. It's your hormonal release that's like going through your body. So it's a feeling. So you could have been like transitioning, but your cervix just like wasn't reflecting like what was going on in your body.
Right.
And your body was obviously working extremely hard to try to get this baby in an optimal position. And it's that's also like kind of the problem with the birthing system, is like, in the hospital they want XYZ. You're just on this curve and that's it. And that's not how it looks for everybody. And so it's, yeah, it can be more of like a feeling and not necessarily like a number. Um,
Yeah, I think that's something that's like a problem we have in the birth world, is holding so much value on the dilation number when it can look so different for every person. You know, my doula had a birth not too long after mine, and she texted me and she's like, my mind is just blown because I have a mom who's at a 4, and I just think about how long you were at a 4 and the
Mhm.
intensity of labor at that point and working with you through that. And she's like, and this mom just happened to go in and get checked and was at a 4. And she's like, it's so like birth is so unpredictable and everybody is so unique, and dilation just isn't a good indication
Indicator, right.
for how intense labor might be, or how how far you are progressing, because it can feel so different person to person.
Right, right. Um, yeah, birth, I mean, it's obviously like I'm super passionate about it. And it is wild. Like it's the craziest thing that like you're ever going to experience in your life. And
Mhm.
there's so much like physically, emotionally, spiritually surrounding it. Um, and so that's why I am a huge fan of like having these plans, choosing the right birth team, because when things don't go as planned, like imagine if you transferred into that hospital and your doula wasn't there and your home birth midwife wasn't there and it was just this OB. Like, like that, nobody like validating how you feel, like nobody really
Right.
feeling like they're on your team, like that,
Mhm.
even though your birth plan didn't go as planned, you at least like had people
Yeah.
who were
I had
supporting
people
you.
there who believed in me, believed in what I was trying to do. And
I don't want to say like at least you had, because that I feel like that feels invalidating because um I don't like when people are like, oh, healthy baby, healthy mom. It's like, okay, but like,
right.
how did you feel? How was your experience? So I didn't mean to say
Yeah.
like, at least you had this. Like, it's
No, I think it would
great
have
that you
been,
had this,
I definitely have, there's trauma that comes with having
Yeah.
a C-section like that, and having, you know, an OB that has horrible bedside manner. And, um, but I am so grateful, yeah, that I had the team that I had, and had the knowledge that I had going into it too, because they really don't tell you much of anything after you have a C-section. At least at the hospital I was at, they didn't. And I'm like, this is a major surgery. This is a major abdominal surgery. And I'm laying there like hours after, kind of like, what's next? Like, shouldn't someone be coming and telling me kind of like what our game plan is? And luckily there was a shift change, and I had a nurse who was like, my goal for today is to get you out of bed. I want to see you walking today. If we can make that happen, your your outcome for recovery is going to be so much more if we can do that. And because I was diagnosed with the preeclampsia, I had to do the magnesium drip afterwards, and I felt horrible. I felt, I think, worse from that than actually having the C-section. But once she told me that like the goal was to get out of bed that day, that just lit a fire under me. I'm like, that's what I'm doing. Like, I'm gonna do whatever it takes at this point to make sure that this recovery goes as good as possible. And um, within the first day, I was able to get out of bed and walk to the bathroom, which felt like, it sounds so silly, but that felt like I just climbed Mount Everest. How satisfying and how accomplished I felt from doing that, because the first time they tried to get me to sit up, I could barely sit. And I'm like, how the heck am I going to be able to walk? How am I going to be able to lift my baby?
Hmm.
And so being able to actually walk that first time was like so empowering in that moment, that I was just like, I'm doing this as efficiently as I can to heal my body and get out of here. And I was actually one of 4 C-sections that day, which that's a whole other discussion in and of itself, because I know statistically all 4 of us did not need C-sections. Um, but they told me with the incision I had, having that inverted T incision, that my recovery would be like the hardest. And I was actually recovering the best out of the 4 of us that had had C-sections on that day. And I really think that all of the prep work during pregnancy that I did between chiropractic care and pelvic floor therapy, and just trying to nourish my body as much as I could with having hyperemesis, I think that really set up my body for more success with healing. And then immediately when I was cleared on I think it was the third day I was cleared to finally take a shower. I was like, I need to start on my incision work right now. And that was something that luckily I had the knowledge of as being a chiropractor and doing scar tissue work. Um, I knew that the sooner that I could get comfortable adding sensation back to the area, the better I would be with tissue healing. Um, and so I took a shower and I started kind of feeling around my belly, not going near the incision, but just kind of the areas around and trying to just work through that, which can be super emotional and bring back all the feelings. But by the time I was at my 2 week appointment to have my incision looked at, she said it looked really great and that I was actually cleared to start working directly on my scar at that 2 week point, which doesn't typically happen until closer to like 4 to 6 weeks with normal incision healing. So I was really grateful for that because I was able to really get in on my scar tissue early. Um, and like I have totally normal sensation where my scar is now. I don't really have a lot of adhesions. My scar has healed really, really great. I don't have a shelf because I was really diligent about doing scar tissue desensitization and mobilization on that area afterwards. And so that's something that I've really tried to put on Instagram and share with people. And I try to share in the office now because I think it really helped my recovery. And there was no instruction on that, which should be a part of the healing process. You had a major surgery, someone should be there to kind of guide you through that. And unfortunately, that's just not how the system operates right now.
Yeah. That's amazing that you had that knowledge. If people are listening, like where would they go to get that knowledge to learn what to do with their scar tissue?
So on my Instagram, I made a couple posts about scar tissue mobilization. So that is a resource. And then Mama Stay Fit is another Instagram page that I really like. They share quite a bit on scar tissue mobilization and exercises that you can do to help kind of wake up your fascia and your muscles that have been kind of traumatized from the surgery process. And then also Expected and Empowering. Also on Instagram, they have a bit on scar tissue mobilization too. So I've found that Instagram is a great resource for that because you can get your hands on some videos for free versus trying to buy a program or go down the rabbit hole of Dr. Google. And
Yeah. Yeah. I can link some of that in the show notes too, so people can find it easily. I do want to go back to something that you said when you're talking about it, like kind of like being in the crunchy community and then like not having your birth plan come out the way that you planned. Because I do think that there's a lot of mixed messaging out there. And I know that you and I both really take like a holistic approach. Like we are big on the birth statistics and like what kind of breaking the status quo and wanting people to be informed so they can make different decisions. But there are time and place for things. And like sometimes it just kind of feels like in the crunchy community that it's just like eat liver and have a home birth and everything's going to be okay. And that's all you need to do. And that rhetoric can be damaging.
Mhm.
And especially if I'm sure like your Instagram feed is probably very similar to mine. Like it's a lot of like holistic and nutrient and then birth. And like that's like basically all my feed is.
Yeah.
And it can cause a lot of guilt. Like even if I've had a couple of births that didn't go at all as planned and had interventions that I didn't plan. And I still feel like maybe I failed or I like with my last birth, I ended up taking castor oil. So I'm like, that was an intervention. Like, and then he ended up going to the NICU and I'm like, okay, like maybe I caused this and I should have just done nothing. But we also have intuition. And I
For
feel like
sure.
that's like
Hindsight
leaving some of it out.
like we are so hard on ourselves in hindsight when we have just this perfect vision of how everything played out. And, with my birth, I went insane going back through everything, going, well, what if I wouldn't have done a cervix check? And what if I would have, what if I would have been tougher? And in the moment, I would have just sucked up those different positions and all the things. And I'm like, going crazy thinking about all the what ifs and what if the epidural made this happen or what if doing Pitocin, and it's like hindsight we can drive ourselves just absolutely nuts with, but in the moment, that intuition is so strong. And I feel like when you come into birth really prepared to, and you have a lot of the knowledge of it, I don't think our intuition leads us wrong in those moments. I really think that birth is such a primal thing for us that when you take a step back and you take the logistics of it out, we're all just making the best decisions that we feel called to do in the moment. But I had, so much guilt. I would say it started for me, especially with having hyperemesis, because I had this vision of like, Real Food for Pregnancy by Lily Nichols is like the Bible for pregnancy, like I use that as a resource so often. And here I am unable to keep anything in my body besides Honey Nut Cheerios. Like one day that sounded like something that might be good. And it was the only thing that I didn't throw up on a long list of foods that I had been throwing up. And so that was like, okay, I guess I'm eating Honey Nut Cheerios now. Like, would you catch me? Like, I don't think I ate them for probably 10 years prior to that because I know better. But in the moment, it was something to sustain me. And I had so much guilt with the fact that I wasn't eating avocado toast and eggs every morning for breakfast with homemade sourdough bread and, doing all of the things. And I just realized, that was really humbling experience having hyperemesis was like, gosh, not, one size does not fit all. And taking beef liver as a prenatal does not work for every person, especially if you have hyperemesis, because that can cause a histamine response. And that can make you feel worse. And, everyone loves to give their unsolicited advice. So when I was pregnant, it was always, well, what worked for me? I just ate little snacks all throughout the day and I was fine. And I'm like, oh my gosh, I have hyperemesis. This is way different than just morning sickness.
Right.
Anything I eat's coming right back up. So I'm not doing a bunch of little snacks throughout the day. And so I feel like with birth too, having had that experience with the hyperemesis, I just tried to have a lot of grace for myself and be like, okay, my birth was not at all what I had planned. But would I be this hard in saying these things that I'm saying to myself if one of my patients came in and had the exact same experience that I did? Would I be saying these words to them that I'm saying to myself that are so harsh about being a failure and not being able to do this? Absolutely not. I would tell them that they did the best that they could, that it doesn't make them any less of a mom for the way that they gave birth. And so I think that was the best thing that helped me, was trying to take a step back and saying, wow, I would never talk to someone else the way that I'm talking to myself about this. I would never want someone else in this community to feel the way that I'm feeling right now. So this is my opportunity to now use my experience to try to help empower other women to, be prepared and have the plan that you want to have, but be able to be adaptable and know that it doesn't always go as we planned. And that is okay too. And that can suck and we can grieve that and, grieve the birth that we wanted to have, but it doesn't make us less of a person for having our baby in a way that we didn't originally plan.
Yeah, that's so good and so true. I'm glad you said that because I know that, there's so much guilt. Like, I think just as women, maybe we naturally carry more or something. It's
Yeah,
like, well, I
definitely.
mean, and I think especially there's just been so many misconceptions about, like, just for the longest time, even surrounding like miscarriage and fertility, and all of that is on the woman, whereas like the man is 50%, and we're even
Yes.
seeing those fertility rates change. And even with miscarriage, learning like, oh, these things that men do can cause a miscarriage because it's
Yeah.
coming out in their gene expression, like with the semen that you're getting, the DNA that you're getting. And
Yes.
we carry it different, we grieve it different, we um, just have a lot of guilt of, I remember with my first miscarriage, like my husband and I, obviously like being a doula, like I know a lot more than he does. And I had been a doula for years, almost a decade before I had my first kid. So um I was taking a bath and he came in, he's like, this bath is way too hot. Like he's just like freaking out, and I'm like, babe, it's fine. Like I'm fine. And then I ended up having a miscarriage. So then I'm like, was my bath too hot? Like I'm like beating myself up about like every little thing. I'm like, maybe that bath was too hot. Maybe like, I remember went to New Orleans for a friend trip and I was like a week pregnant. Like we had conceived a week before and I had zero idea. And I had a couple of drinks there and I'm like, is this why? Like you're just like beating
Right.
yourself up about every little thing. And like that's not what caused it, and so it can be so tough. And then like the intuition piece too is I think so important because maybe you have this plan in your head um of how things are going to go, and maybe things don't go that way, but you also have to like be able to tap into yourself, like as you did in your birth, like just kind of taking time to like pray and to have others do that with you, and to get that peace of like, okay, like maybe this didn't go the way that we planned, but I have peace moving forward in this moment. um and then trusting that like in hindsight that I
Mm-hmm.
made the best decision for myself and for my baby in that moment. Because like you said, the what if game can just like go on and
Yeah.
on and on.
That was something that was super helpful. I'm actually pregnant right now and I will be 17 weeks tomorrow. And we had a consultation with a different OB here. And we were kind of talking through, the birth with him and talking through everything. And I shared that piece with him. I said, I really felt like God in the moment told me that I wasn't having that baby vaginally. Um, and I felt peace about it in the moment. And then we talked more and he's like, "Hey, I just want to bring this up as we're talking about this. You said you had that peace of God in the moment, but here you are trying to kind of go back and talk about the what ifs. I just want to remind you, like, you had peace. Like, God gave you peace in that moment about that. And I want you to remember that feeling of peace that you had when you look back on your birth, because you can drive yourself crazy going through the what ifs. But if you had peace, then I think you made the right decision for yourself in that moment. And God wouldn't have given you that peace to then, like, He's not taking that back and trying to make you question everything. Like, remember the peace you had. And to hear that from an OB was just, I think it kind of floored my husband and I and made us feel really comfortable with him. For him to take the time to acknowledge that too. Um, and I was like, okay, yeah, you're right. I need to not dwell on how it went and just look forward to how things can be different in the future.
Mm-hmm. First of all, congratulations. That's so
Thank
exciting.
you.
I'm so
Thank
excited
you.
for you. Oh my gosh. Um, so how are you planning anything different? If you mind sharing your birth plans, you totally don't have to. Like, are you planning anything different this time around based on how your last birth went?
Yeah. So, like I said, it took about a month for me to really like process and stop feeling sorry for myself after the birth I had. And my midwife pointed me to a group called Special Scars, Special Hope. And it is a group for women who have had C-section incisions similar to what I have. So anyone who has an inverted T incision, a T incision, uh, J incision, classical incision, um, because those are the more unique incisions that we just don't really have a ton of research on. And those are the ones that are typically told that you can never have a VBAC with. And part of that is because we just don't have a lot of knowledge on it. So they haven't done a lot of studies, and so they don't want to risk you giving birth without knowing the statistics on it, because that's how organizations like ACOG work. And so I started getting involved in this organization and reading just hundreds of birth stories of women who had similar incisions to mine, who went on to find a supportive care provider, depending on what state they were in, whether they could have an OB or a midwife, and went on to have vaginal births. And so for me, that gave me enough hope that I was like, wow, this doesn't have to be my story. This doesn't have to be a hard no. Those words that she told me immediately after birth, they don't have to be true.
Mm-hmm.
And maybe I could have a VBAC someday. Maybe that is a possibility. And so I started just trying to dive in and learn all the things about the kind of incision I have, what the statistics actually say. And so I actually did a call with Dr. Stu from
Yeah, I
Birthing,
love
and
him.
did a call with him and my midwife to talk about it. And he read through my report, and we were talking, and he was like, oh yeah, like if you were my patient, I would take you on for a VBAC, no problem. Like the risk is a little bit higher. And when you hear, oh, your risk is doubled, you think, oh wow, that's scary. The risk for a rupture doubles, but it goes from about 0.5% of a risk of uterine rupture with the standard incision to about a 1 to 2% chance with an inverted T incision. And so for me, hearing those numbers, I'm like, why wouldn't I try for a VBAC if I can? Now the challenge is finding a provider who will take me on. And so luckily, we had this meeting with a provider who is not in our town, but is a few hours away, and met with him. And I told him my desires for having at least a TOLAC.
Mm-hmm.
I'm not 100% opposed to having another C-section if it's absolutely necessary, but I'd at least like to give my body a chance to labor again and see if I can have a vaginal birth. And so we met with him, and he pretty much said, if your mind's set on having a trial of labor, I will be the one that's there to support you for that.
Mm-hmm.
And obviously there's no guarantees, and we need to monitor things and make sure that you don't end up with placenta previa or placenta accreta or any of the things that tend to be the riskiest with having a C-section. But he brought up, he said, do you guys know how many kids you want to have? And I said, well, I originally wanted 6, but I don't think my husband wants that many. So we settled on 4 and agreed that we wanted 4. And he's like, and I'm sure no one asked you that before. And I said, they didn't actually. And I know that statistically my risk goes up significantly for things that can happen to me if I have 4 C-sections. And I really don't want that. And so after kind of expressing our desires for, wanting to have a bigger family, he was kind of like, I think if it's something that you really want to do, I don't necessarily advise it, but I'll be there to support you if you want a trial of labor. And so I told my husband, if it's not a no, then it's a yes for now. And so that is what we are planning to do. I am planning to VBAC. I believe that our bodies were designed perfectly, and that the statistics for CPD and the evidence is just not there. So I'm not holding value to being told that I likely had that. And I'm just believing that my body will birth this baby in the way that I'm meant to this next time. And my hope is that that is a vaginal birth.
Mm-hmm. Yeah, awesome. Thanks for sharing that. It's great to find providers who are supportive, and like you doing due diligence to do that, because you're going a few hours away. I know you live in a pretty like small town.
Yes. Yeah.
There's not like probably a ton of
You don't have
options.
a ton of resources. And he pretty much said, I'm in Montana. We don't have, we're a few years behind on a lot of things, but he pretty much told us at that meeting, like, I'm probably the only OB in the state
Right.
that would keep you on for that. And I was like, I appreciate your honesty. And as long as you're willing to support us, like, we'll do what we need to do.
Right. Well, because even me, like living outside Chicago, I find it's so hard to find supportive providers. Like you can hardly find anyone to attempt a breech birth. You can't there's like one doctor here that will do like a VBAC too. And he's like impossible to get into because everybody goes to him for VBACs because he has the highest VBAC rate in the area. And I don't know how he feels about like these scars or anything, but I mean, he even then has, like if we are going to be back, these are things that like we have to monitor, we have to do this, we have to, like these different precautions. Like if you're okay with that, then yes, like so but yeah, it can be really hard like advocating for yourself and finding like somebody to support that, which is really frustrating, feeling like you don't have options and that like maybe you have a few. I love Dr. Stu. He's been on the podcast before. And I love listening to his podcast as well, because he's obviously been an OB for decades and just like has a ton of insight. So, and I know he's spreading that message of that you should have options. Like obviously his huge thing is breech, but like, okay, like here's the percentage, like you should be the one who decides what that risk is.
Definitely.
And then, then you need to have a provider who's okay doing that. Cause like, if you're in a situation with a provider who's not, just like the anxiety and the like wanting to continually intervene and like, and then this kind of takes me back to the holistic community of where that can be damaging is because I'm sure there's probably people that are like, well, then just free birth. And it's like, well, that might not be an option for me. Like maybe I'm not comfortable trying to free birth my baby.
Yeah. And I talked to my husband about that because, we went into that meeting knowing like this is kind of our option. Unfortunately, in Montana, midwives are restricted on what kind of scar for VBAC they can take on. And my midwives can't take me on with the kind of scar that I have. The hospital midwives can't. And I know that the OB that did mine would, of course, not take me on for that. So we kind of went into that knowing like this is our chance. Otherwise, a free birth would be the only option. And my husband kind of looked at me and he was like, no. And that's fair because he saw me cut open and he saw what that looked like. And knowing that we had a non-emergent transfer before and what that looked like, I don't think that free birth was even a possibility on our minds for this time. Going through the risks and not wanting him to feel the pressure of that. And then if he's not comfortable, I'm not going to be comfortable. And so
you'd be transferring to like the same hospital and maybe the same OB that you did before.
Yeah. There's just too many variables with that. And people who free birth, wow, good. Like I had a friend who free birthed twins and she is an absolute badass and everything went great for her. I think I'm too logistically minded to not have the fear of all of the risks in my head at the same time to be able to have a free birth. But we pretty much went into that meeting kind of like using that almost as, I don't want to say leverage, like trying to be deceptive, but kind of telling him like, like if you're our only option and I really want to have a labor, like what are other options? And he was like, I don't want you to do anything crazy, like try to have a free birth. And I was like, I don't want to have a free birth either. So like, let's work together. Let's make
don't make me do it.
So yeah, don't make me do it pretty much.
Yeah. Well, that's good that you found a supportive provider and I can't wait to follow your journey and we know that like you said, like however this birth goes is the way that like you were meant to birth this baby. And so that's exciting. Are you guys finding out what you're having?
No, we are waiting. We are deciding to be surprised this time, which I never thought we would do because with my daughter, we found out when I was 7 weeks. I was like, what is the earliest I can do the sneak peek blood test? Like, and I think part of that was because I had a miscarriage before her. So I felt like having her, I felt like I needed to know everything and wanted to be able to connect with her. And this time we found out, and my husband was like, I think we should be surprised. And I was like, are you sure? He's like, yeah, I think it would be cool. And so we're going to be surprised this go around. And I'm excited because everyone who's been surprised has told me it's just the best moment of,
Yeah, we love it. It's so much fun.
You've
It's
been
so much
surprised with
fun.
all three of yours, right?
Yeah,
Yeah,
yeah.
okay, that's what I thought.
It's so much fun. Um, and then how are you feeling this pregnancy? Do you have HG again?
I luckily do not.
That's awesome.
The Lord has answered my prayers. I am so grateful. I definitely still had nausea and vomiting, but not to the extreme of HG. And I am so thankful. Going from having to take Zofran every 4 hours the last
Oh my
pregnancy
gosh.
to, I had to take Zofran for about 2 weeks this time to be able to work. And then I stopped taking it. I was like, oh my gosh, like, can I actually enjoy a pregnancy? Is this going to be a good one? So now, yeah, I'll be 17 weeks tomorrow and I'm feeling so much better. I feel like I finally get to enjoy like the second trimester bliss. I'm actually feeling more energized and yeah, my nausea is totally gone now and I am so, so grateful.
That's amazing. Oh, good. Yeah, I feel like the people that I've talked to who have had hyperemesis, it kind of also plays on wanting future children because you feel so awful.
Oh,
So how were
definitely.
you able to like gear yourself up to potentially be throwing up every single day, multiple days for months?
Yes. I think it's really great. We live like minutes from family. My husband's family's all around us, and they have been so supportive. And when we told them I was pregnant this time, it was kind of like all hands on deck for like, what do we need to do to make this a good experience if you end up having HG again? What
Mhm.
like will help with the toddler? We'll do like cooking. And my mother-in-law was great last time. She came over and helped with laundry and meal prepping for my husband and trying to like she ran to every possible health food store in our valley last year or 2 years ago when I was pregnant with my daughter to try to do like every possible, Preggy Pop or Ginger Chew or like any of the things that might potentially help me feel better. She was doing that. So knowing the support we had and knowing um, how helpful the weekly IVs I was getting were, knowing that I could do that again, I think helped me prep like, okay, I can for sure do this one more time. We pretty much said like if it's horrible again, we might settle on having two kids, but I was like, I can for sure do this another time. I have tools. I know what to look for. So I felt very proactive this time around, knowing like um I waited until I was like 9 weeks and like so depleted and so sick to be able to like finally go into the hospital to get Zofran or do anything last time. And part of that was like the pride of being crunchy and not wanting to take anything or do anything. This time I was like, okay, last time it hit me like right at 6 weeks. Like if I hit that point and I start even feeling like I'm on the verge of being that sick again, I'm going to go get help. And so I think that really helped me taking more of a proactive approach. And I feel like too, something that I think did help me was like the way I nourished myself postpartum. And I really, really prioritized nutrition and supplementation and exercise because I wanted to just make my body the most ideal environment that I could, knowing HG is unpredictable and you can be the healthiest person and still end up with it. But I wanted to know I was doing all of the things prior to conceiving that I could to hopefully help create an environment that I might not have HG, or if I did have HG, that I would be starting off in a nourished place so
Mhm.
that my baby would be getting nourishment from the work I had done preconception too.
Right, right. And that kind of would give you like peace of mind that if you can't keep anything down, that like you had nutrient stores, just like you
Yeah.
said, for like baby to get those. I don't remember who I was interviewing, but we were talking about how like basically your first trimester, what's going into the baby is like everything you did prenatally, like
Yes.
the months
Yep.
before.
Yep.
So when you are throwing up and feel like you have nothing there, they're still taking from like what you've built up. So
Yeah.
it's important to do that, to like have that build up. Um, but that's awesome. That's so good that like you're feeling good and healthy and not having HG again. Oh my gosh, I can't imagine. I just feel so much for people who who have that, because also like it's downplayed, like you're not believed as much, like, oh, well, you're pregnant, like,
Yes.
of course you're
Yeah.
going to get nauseous, like, oh,
Mhm.
it's just pregnancy, everybody has this. And it's like, no, not everybody has hyperemesis. Like,
Yeah.
it's not even close. Like, being nauseous and throwing up sucks. Yes, it's crappy for anybody who has that,
Mhm.
but HG is like a completely different level that like you can't compare.
Right. And I think the other thing that gave me hope with like having another baby was how recent like the research has come out on HG that they've been doing. And I feel like that made me feel like empowered of like, okay, I'm not just going to be totally out of luck if I do have HG, or if I, future pregnancies, like by that point, maybe they'll have even more research on how to um, balance the GDF hormone that is supposedly the cause that they're finding of the HG. And that just having that research came out gave me so much hope, because I feel like I had so many people throughout my pregnancy say, oh, well, I had a friend with HG and their subsequent pregnancies were so much worse. And I'm like, how can this get worse? And
Right.
I think stories of, some of the founders of the Hyperemesis Foundation, like they lost their babies because they were so sick and they were on
Yeah.
like feeding tubes and stuff. So I was like, well, thankfully I wasn't to that point. So I at least had like perspective on like, okay, I had it pretty, like I was rough, I was in rough shape, but like there were definitely people out there that had it way worse than me. So I had that perspective too of like, okay, mine was rough and it was a season and it was bad, but like it wasn't as bad as some women have. And now they're finding ways to mitigate that. So that gave me more hope for future
Hmm.
babies too.
Yeah. Yeah. Well, I just want to thank you so much for coming on and for sharing your story. And I'm honored that like we're the first place that like you're sharing the full thing,
Yes.
and just getting to hear it. I know so many people listening could resonate to different parts of your story. Um, I know there are parts where I'm like, oh my gosh, like I feel this, um, and I think it's so important to talk about, like, to normalize, like it's so important to be educated and informed and to have a plan, but it's also so important to know that it might not go according to plan.
Mhm.
And how do we handle that? Like, how do I feel empowered if it doesn't go according to plan? How do I advocate for myself if um if I'm being told something that I don't agree with or isn't a part of my plan? So um, it was just really, really great hearing your story. So thank you so much for sharing it with us. Um, before we wrap up, let me know where people can find and follow you, and I'll include all of that in the show notes. For everybody listening, she had mentioned in here that she's a Webster certified chiropractor. And so doing prenatal chiropractic care, and shares like a lot of that stuff on social media as well. Um, which I don't feel like I've like fully dove into either. Like some, but not like all of it. I feel like there's like always like changing aspects of it as well. Um, so let everybody know where they can find and follow you on
Yeah,
Instagram.
my Instagram is Maggie Hill DC. And I share a lot of prenatal specific stuff on there. Our business page is Exceed Chiro, XSEED Chiro. And my husband and I share stuff on there as well through our practice. And yeah, I just really appreciate you having me on and holding space for me to be able to share my story today.
Yes, thank you again.